This recording, I just want to talk briefly about the hemolytic disease of the newborn, which is an issue with the Rh factor. So if you have an Rh negative woman and she becomes pregnant with an Rh positive baby, what can happen is there you have the baby's blood cells get into the mother's bloodstream. If there's somehow a mixing of it, it could cause the woman to produce antibodies against the Rh factor, which is going to take a little bit of time. Her first pregnancy is not a problem. It's any subsequent pregnancy, or if she's actually given a transfusion on accident, which you shouldn't do, of Rh positive blood. So what happens is, these B cells develop into plasma cells, produce these anti-Rh antibodies, and you have a subsequent pregnancy where the child is Rh positive. Is if there's a mixing of the blood, those antibodies against the Rh factor will attack that baby's blood cells and cause what we call hemolytic disease of the newborn, and can lead to loss of that child. So to prevent that, what happens is a mother is treated with RhoGAM. And what RhoGAM is an example of passive immunity. We call it artificially acquired passive immunity, in which the mother is given an injection of these antibodies for the D antigen. And so what it does is it masks those antigens, and it prevents the mother from developing an immune response and not having any memory cells being developed. She gets it during so many weeks during her pregnancy and within 72 hours after the child is born. This has to be done with every pregnancy because this is a passive type of immunity, and it's not very long lasting, so it has to be done with every pregnancy. Now the question is, why is ABO incompatibility between mother and child not a problem while Rh factor is? It does come down to the type of antibodies. IgG antibodies, the IgG type, cross the placenta, and the Rh factor antibodies are that type, so they can cross the placenta. But the antibodies for the ABO blood types are IgM, and they don't cross. So you don't have to worry about if I'm type A and my daughter's type B, us having a problem because of that, because those antibodies don't cross the placenta. But the Rh factor antibodies are actually type that can actually cross the placenta.